Well, let's stay with some COVID-19 news now. And the COVID-19 Ministerial Advisory Committee, or MAC, says quarantining and the tracing of contacts is no longer needed. It says the situation changing since 2020 and management of the virus must also be adapted. Let's just remind you what we mean by tracing. Of course, if you knew someone who got COVID-19 and you were near them, you on occasion would have to go into isolation for a period of a few days, about 7 to 10 days as well. It seems that a memo, though, has been sent by the committee to the Health Minister Joe Phaahla. So is this a good idea? Do we really think everything has changed that much? Well, Public Health Specialist Dr. Harsha Somaroo joining us. Doctor, good to have you with us. So are we at that point now where we can take away the public tracing of COVID-19?
Good morning, Gareth. Yes, I think that this has been a discussion for some time now, and the Ministerial Advisory Committee has put together a set of evidence-based recommendations outlining why we're at a point where this might be the right time to actually do away with contact tracing. I think at the beginning of the pandemic, we really didn't understand much about the transmission dynamics compared to now. Also, when they do decide on a specific policy response, we look at the rationale for it and also the feasibility. And I think the one thing is, over time, we've realized that, especially when the numbers are high, it's not possible to detect all contacts of COVID cases. And at this point in time, in terms of where we are as a country, there's a lot of natural immunity and vaccine-induced immunity, which might also decrease transmission of COVID to people. So there's a lot of contextual factors that are being considered, and this is an expert body that really considers all the evidence and has made this recommendation, which I think does make sense at this point in time.
There are some critics coming out this morning, though, Doctor, suggesting that because of the various public announcements that Omicron is a lot more transmissible, yes, it doesn't seem to be as severe, but it's a lot more transmissible, that this might not have been the best idea to get rid of contact tracing right now because of this new variant. What do you say to those critics?
I mean, yeah, I think I can understand where they're coming from. Regardless of whether the variant is more transmissible or not, I think there's certainly concern of people being exposed to somebody who may have COVID. But I think this is where the public health measures need to be emphasized as well. As much as we're saying that it might not be that effective or maybe practical to trace all contacts and put them in quarantine for a period of 10 days, we still have measures at hand that will prevent transmission of COVID-19, especially physical distancing, ensuring people are in ventilated spaces, and wearing a mask when you're in contact with other people. I think those are things that we do need to emphasize now. And I mean, with the stop of contact tracing, I think it's also important to emphasize that COVID is still spread through contact, and so we do need to manage those risks as well. I think this policy is really, this recommendation is really aimed at the practicality of this particular part of the response, though I think we still need to manage how the risks for transmission.
And I can see a lot of people, Doctor, watching you and I speak at the moment going, oh, fantastic. So if my husband gets COVID-19, then I don't need to declare that I've been near him because I'm not going to be traced having been close to him while he gets COVID-19. That's not what we're talking about, is it? I think we need to be very clear that we're talking about walking around a shopping centre, you've signed in at the front door, and someone you don't know, unrelated to you, gets COVID-19, you have to isolate. We're still, I think, need to be clear that when it comes to close contact, family members, loved ones who get COVID-19, you also need to isolate. Or have I got this wrong?
No, I think you've got it absolutely correct. I think it's important as well to emphasize that this is a policy perspective, and it's really talking to the formal contact tracing that's done by the health system. However, if your relative gets COVID-19, you do know that you are at risk being in close contact to them, so you should actually maintain a good distance and wear a mask whenever you're in contact with them to prevent transmission. And so then there's two levels we need to consider. One is this public health level where we're including practicality and feasibility within the health system. And then there's the individual response, where I think individual autonomy and responsibility come in as well. The risks for COVID have not changed. So we still need to manage those risks at an individual level in the same way that we have previously. It's just that from a health system perspective, it's realized that at this point in time, it's no longer feasible or practical to continue with the formal contact tracing that's done by the health system.